This is July the 6th, 2023, and I'd like to call the Board of Health meeting to order. We have a quorum. In fact, we have all three members here, so I welcome everybody. And we have Director of Tri-Town Health Department, Jim Willis here too. And so first thing, before we get started, I'd like to thank Dr. Henry Schwerner for all of his years of service on the board and all the contributions he made for the town during that period of time. And secondly, I'd like to welcome our new member, Dr. Elias Lefferman, sitting to my left, who was just elected. And I welcome you, and I hope you have a good time on the board and have a very profitable experience. The next item on the agenda is to approve the prior minutes. We have the minutes from the March 10th, 2023 meeting. And has everybody read them? Okay, I have one correction for the minutes. I think that under new business, the second paragraph, second line, the person speaking during Citizen Speaks time was Denise Forbes. And I think that should be corrected to be that D-E-N-I-S-E, last name F-O-R-B-E-S, who was from Housatonic. Otherwise, I don't have any other corrections. Anybody else have any corrections?
I move that we accept the minutes.
Can I have a second for that motion?
Second.
Okay, all in favor?
Aye.
You want a roll call vote on Jim, or can we just vote?
Yeah. I don't think we need to do a roll call because we don't have a board member on.
Okay, good. All right. So let us then move on to the next item. The meeting, the minutes for March 10th, 2023 were unanimously approved. We have election of officers. Now, since Dr. Lefferman is a new member of the board, I'm going to explain the procedures as we go along a little bit. If it gets too much for you, you can let me know. Kick me in the ankle then. It's a good way to do it. But the idea will be, I'll just try to explain some of the procedures we go along. Every year we look at the membership again, and especially when we get a new member, we look at the membership, and we have basically two elected members. One is the chair. I'm the chair at the present time, and second is the secretary. John is the secretary. And so I am now opening up the meeting for a motions for chairman, to nominate chairman. So
I'd like to nominate you.
okay, and do we have a second on that?
Second.
Can we have a vote on that? Roll call vote?
John, I vote yes.
Elias votes yes.
I'll vote yes too, because I'm very happy to do it, and I appreciate your confidence. Thank you very much. Now I'd like to say that historically, when we have a new member on the board, we traditionally nominate the new member to be secretary, to get his feet wet and get involved in all the stuff that's going on. So I would like to open up the nominations for secretary at the present time. Could we have a motion, nomination?
I nominate Elias Lefferman to be secretary.
I second the nomination. Can we have a roll call vote on that, Jim? I would like to. Dr. Ledici?
Yes.
Yes, okay. I say yes. And Dr. Lefferman says yes too, I presume. Or no.
And I can walk you through the best ways to do minutes. It doesn't need to be verbatim, like a transcript. It's really just in all our meetings, when we're done, it gets posted on the CTSB website. Mm-hmm. And so if you want to do the minutes right afterwards, it takes a couple of days for the video to come up, and it'll be archived anyway. So it's just a matter of, the most important thing is, catching, the first and the seconds of motions and votes and stuff. And I can send you a bunch of the previous minutes to give you an idea, but you don't need to be spending 30 hours doing minutes. It's just a summary of.
Well, John told me it takes about 20 hours.
Yeah.
Cut back on
certain meetings that have like public hearings and stuff sometimes will be more detailed than others, especially if there's a lot of citizen speak time on a very important subject. I'll tend to go a little bit deeper in minutes, but we're not required by law to do a full onslaught transcript. So it's not, and we meet, I think, quarterly or as needed. So it's not something we we don't meet every 2 weeks to be spending all summer long in front of a computer typing minutes. So
Thank you.
Now, so just, I like the idea, when I was doing it, I used to, and I've been on other committees too. I think taking notes is a really good way to do it. That gets you going. And then secondly, what I used to do, I have a little hand recorder, and so in the car on the way home, I would dictate what I thought was going on too and bring up different points and bring up things, and I would supplement my notes, and then you can always look at the recording after.
And you can teach me how to use the recorder on my phone, and then I can use it from there.
And I can help you. If you get a draft, you can always email to me. I'd be more than happy to.
Okay, great.
Double check everything and
Really
whatnot.
do the highlights and then
Yeah.
tell people that they can look at CTV
Yeah.
for the more in-depth
Right,
analysis.
absolutely, yeah.
Okay.
Okay, so let's move on to the next order of business, and I'll just explain this to you. We have traditionally in the Board of Health, we have a period of time when we ask for input from the public. Unlike the Board of Health, the public doesn't have to confine itself to an agenda. The public can talk about anything they want to. By law, we're required to speak and discuss only what's on the agenda. Now, the reason for that is to be fair to all the people who are interested. So, for example, you might have a person speaking about an issue that is very important to them in the citizen speak time, but it's not on our agenda. Now, we can't engage in a discussion about that in citizen speak time because it's not on our agenda. Right. And it wouldn't be fair to somebody else, let's say, who had a different point of view, who would like to put that point of view in at that point, but since it wasn't on the agenda, they didn't say anything. They didn't have the opportunity to do it. So that's the basis for us not interacting with people during citizen speak time most of the time. We will ask people who during citizen speak time, this is the chair's prerogative, and this is what I always ask people to do, is to state their name very clearly and where they live, town of Stockbridge, wherever. And that gives us the ability, and also to spell it if there's any question, also that we can have it in the notes who said what about what. And that's a good way to do it. And I also like to, generally speaking, if there's going to be a big bunch of topics, sometime, for example, during the coronavirus, we had some pretty contentious topics that we had to discuss. I tried to limit people's time to 3 minutes and then revisit it if everybody had gotten a chance to speak. But in general, what we try to do is we don't interact with the citizen speak time, and the citizen speak time subjects do not become an immediate part of the agenda. In fact, we can't relate to them during the meeting unless they are a part of the agenda. So we don't want to discuss what is brought up during that time, during that period of time. So what I'm going to do now is to open up the citizen speak time, and I hope that the people listening understand that I'd like you to clearly state your name and where you live. And also, if I don't think it's going to be particularly busy, but, be reasonable in terms of the time that you speak. I won't set any specific limit.
We have one person on. You can unmute yourself.
You have to unmute yourself, Anita.
Hi, Anita Schwerner, Lake Drive, Stockbridge. I really didn't have anything to say, but I did like your explanation of citizen speak time. I was interested in actually your agenda items and what's happening with the bowl, with the cyanobacteria follow up on the Stockbridge bowl. But thank you for recognizing me. I'm sorry there's not more people here, but I'm sure they'll all watch later on CTSB. So.
Okay, well, you can convey to Hank our gratitude for all the years of service he gave on the board. Would you please do that?
I will do that, and I'm sure he will enjoy your discussion of taking minutes.
Yeah, thanks. I'm here.
Yeah.
Okay, that's good. All right, now, so are there anybody else wishes to speak? Okay, there not being anybody else, I'm going to close the citizen speak time unless Mike wants to say something.
No, I'm just here for your
Good.
agenda item.
Okay, very good. Okay, now, so the next topic is the opioid settlement funding, the pooling and how this is going to be organized. We brought this up at the last meeting. It's contained in the minutes. Jim, do you want to take that item?
Sure. So this has been a process that has been going on for a couple of years now. There's been multiple lawsuits settled through the AG's office and across the country, I may add, going after the manufacturing companies that really targeted folks that are addicted to opioid abuse and deaths and so on and so forth. And so there's a series of settled lawsuits, and each municipality is getting a share of dollars to be put back into opioid prevention in that kind of work. And so we've been, Tri-Town and our Southern Berkshire Collaborative, been working with all the South County towns for about a year and a half on this. You know, some towns are getting $100, some towns are getting 60,000 a year. It's in this lawsuit, payments are going to be going to every municipality, I think, through 2031. And so several South County towns, in the process of which to move the money to an organization still remains to be seen. There's a lot of, Mike may know more than I do. It may require a special town meeting and so on and so forth. But in any event, the state has recommended that towns kind of get together and pool their resources to get the most bang for the buck. And so what we've been working on through our department, through advocacy, because the Board of Health doesn't really have a say in how the money is spent other than to advocate and tell the select boards and the townspeople what we think is a priority and how the money should be spent. So several South County towns have actually already made a decision to sort of pass through their settlement funds to the Rural Recovery Center. And for those that don't know, there's an FAQ on the Rural Recovery Center, and there's sort of like a white paper on them. It's an organization through Railroad Street Youth Project. They have a brick and mortar building now in Great Barrington, but they actually serve all of South County, including town of Stockbridge residents. They do things from Narcan training to they hand out Narcan. They have counselors that go to people's homes. They provide warm handoffs services. They help them find beds. A comprehensive opioid program that we don't possess the skill set or staffing to offer. And so rather than towns just giving the money, spending the money and not really sure what to do with it, they're passing that money through to the Rural Recovery Center to keep them afloat, because they're sort of they just started out a couple of years ago and they're sort of like barely surviving on grants. And for us, it makes the most sense to have the Rural Recovery Center get access to this funding. They'll do all the reporting, they'll come to meetings routinely, and they provide all the services. The town of Lenox, who I think is getting the most allocation, has already voted several months ago to give them 100% of the dollar amounts, however that works out, whenever that happens. We met with Lee. They're going to be giving a large percent to the rural recovery, and we had it on our agenda, but I think we tabled it to kind of get more information. It was during the spring and election, and Mike Canales, town manager for Stockbridge, is here, and we have had a couple conversations about his thoughts and ideas on that and how it has worked in other towns. The Board of Health voted to have me send a letter of recommendation to the select boards for consideration. It's not a requirement. And if Mike wants to talk about this concept and if he's amenable to it, it's just a matter of the select board making the decision whenever they get to it.
Yeah, as we've talked about, I think that it's a great idea to send it to that program. I don't see what other use we would have. The use of it has to be around preventative recovery for opioids, and this is the one program in South County that seems to meet the criteria. So I'd be looking for this board to make a recommendation to the selectmen to have the funds given to that project. We've taken in about $4,000 and something over the last 2 years, but it's not a huge amount of money, but it's money that's separated out and we need to provide.
You say there's a brick and mortar building
It is a building. It's right on, whatever, what street is that? It's,
at Bridge Street?
Bridge Street, yeah.
So other than the basketball court and the sliding, are there any licensed people that are monitoring or developing any programs for these kids?
So they're, as far as I'm aware, is that they're certified and trained therapists that help do the opioid prevention with families, more than what we don't have anyone certified to do that.
Okay.
So they, in their summary, the Rural Recovery Center, there's a whole list of things, services that they provide. And we have a South County opioid working group that we have a seat at the table. It's several agencies that meet monthly, and I think it's on Zoom. It's the health system's on that, the rural recovery's on that, boards of health are on that, town administrators are on that, Fairview Hospital's on that. Because we have the BHS van that goes around too, that does some of this, so the sharps and the harm reduction van. We're all part of the same, not the same organization, but we're all in it kind of together, fighting a similar cause. And right now, the Rural Recovery Center is really the only folks that have stepped up and have come to the table to request these funds. This is something where people aren't lining up asking for these resources. And since they serve Stockbridge residents, our residents have access to that program. And although the brick and mortar, they go out in the field. They've actually come to Lee, to the park, to meet with families to help them. We don't possess that skill set or capacity to do that. And to me, it's like the opioid settlement funds, and whether people agree or disagree, I think it's social justice dollars finally from the years and years and years of targeting to our populations. And we've lost a lot of people, and the effects of opioid have really pushed into the finite locations of our neighborhoods. And although we've lost people, there's still longstanding effects with family members, that are still struggling for this. And for me, it's once in a lifetime funding. And I think there's more money coming, by the way. These settlement funds, I think there's more coming. And my opinion is it should be put into an organization or something or a program that really help these people. I don't believe that supplies should be bought and put on a shelf. It should go to a group that knows what the heck that they're doing, and we can ask for routine updates as town officials on this. And I think it's once in a lifetime opportunity funds, and all I hope for is it's spent the right way for the people that are associated with this.
Elias, would you like to say something?
Yeah, I agree with John, making sure that there's trained personnel, a KDAC or MSW, whoever it might be. And I too agree with the idea of pooling to maximize effectiveness. Who audits it? I mean, there's not a lot of money, but there'll be more money. Who's doing the financial audit to ensure that the dollars are accounted for in total, not just for?
Great question, and I probably don't have the answer to that. We're still trying to understand the actual formula.
More than likely what we do is we would issue what's called a grant assurance letter stating that we're going to be turning these funds over for them, and we'd expect that typically, we gave $16,000 ARPA funds to BCAC for help mitigating knob-and-tube wiring in homes that were preventing homes from being upgraded. And what we asked them to do is every year supply us with a report, show us where the money was used and the rest. So we would do something like that, and then we would just include it in our annual audit. So it would be, yeah.
So that would be on another question on that. The provision of naloxone. How is that provided to our EMTs, first responders, to our police? I know the police don't carry it, and there's a variety.
Some police don't, yeah.
Our police don't too. I know that. And I know there's a state law that's being presented, and that will have our police contracts have to be renegotiated. But is there any plan to make sure our police have it available, that the public knows that it's available and where?
Yeah, so it's readily available. The Rural Recovery actually does trainings. We actually, our Southern Berkshire Collaborative, which is a subset of Tri-Town, which we help a bunch of South County towns. We actually just had an in-person naloxone training a couple months ago. They actually go out in the community and train schools, but it's for places that want to be able to administer the Narcan, obviously, right? So we can't force the police to carry or EMS, but I know most EMS groups and ambulance are carrying that. And so we've had this conversation a month ago about how can we get this into the schools? How can we get this into private practices? So there are resources, free resources out there for training and supplies. One of the things I sent an email to all three chiefs a couple months ago. I may have included the town managers on that. There's all sorts of free trainings and supplies to get to police departments, EMS, whatever, but they need to make the fundamental decision if they want to carry.
Right. And that also applies to schools, that somebody's gone out and found out that they do or they don't, so that we're on record having offered it and they've made the decision not to accept. And what about like heat and cold? The elderly are involved with taking medications, and at times because they may forget, may be prone to overdosing accidentally. Is there a response we have for heat and court or others who are elderly?
Yeah, so I don't really lead that charge. I don't do any Narcan training, but we can ask the rural recovery if there's any organizations in our jurisdiction that they've done training or people that we've reached out to and have refused. I can put that ask in, but I don't go out there and physically do the training.
That was if the Council of Aging says, our elderly population, some of them are on pain medications. They need reminders. Sometimes they'll overdose inadvertently.
Yeah.
Are they involved in that? Have they seen any need for it? And I just raised that.
I don't know if the councils on age are involved, but I think what we're trying to advocate for is there are resources out there and there are organizations out there that are more than willing to offer Narcan supplies and training. It's, again, that stigma around this is still a barrier that we need to break down. But, in the ideal world, every municipal office, every department, everyone should have access to Narcan. In my opinion, it's just a matter of incrementally getting to that point. But I would defer other town departments, probably to the appropriate departments, because I can't speak on their behalf.
Jim, do you know what the objections are by the police officers who do not want to carry the Narcan to help people out when they need this?
I mean, I can't speak for the police department. I mean, anecdotally, I've heard that, some of it's union, obviously, like some of it's negotiations on adding more to the workload. As a Pittsfield resident, I remember watching the city council meetings with the body cam situation that took months and months and months of union negotiations, additional pay and all this other stuff. So there's training and there's that aspect of changing the job description. I think, obviously training.
The workload of resuscitating somebody with Narcan is a lot less than the workload of getting somebody together.
And I don't know
who
this,
doesn't have it.
and I don't know this to be accurate because I'm not an EMS clinician, but we've heard stories in the field that based on certain situations, when someone administers Narcan, there's that reaction, and some people aren't adequately trained to handle that. Some people freak out, and I don't know clinically the right answer. That some people get angry because they're overdosing, and there's like this abrupt reaction. Some of it's physical, some of it's mental, and I'm not saying it's right, wrong, or indifferent, but we've heard stories from the field where a lot of the medical professionals want to be the ones that are administering because they're equipped to handle that kind of situation. But really, you would have to engage the police departments that know exactly why. And I don't know the number of police departments in Berkshire County that do and don't carry, but I know it's increasing. They're incrementally increasing the number of municipalities that are carrying, and it's becoming a thing. And I think even private practices, I've heard stories where psychologist offices refuse to carry, and and they're seeing patients. It's one of those things where people need to make a liability issue.
But Jim, do you have a recommendation for a motion regarding this that you'd like to have somebody make?
Well, I think speaking with Mike, he would be in favor of the Board of Health making a motion to have authorized me to send a letter of recommendation for the use of the funds to the select board. I can do that. That would be the,
John, do you want to make that?
Yeah, I'll make a motion. And Jim, can you tell me again can you restate that motion?
the motion to sending a recommendation to the Stockbridge Select Board, and it, recommending that opioid settlement funds be, used for the Rural Recovery Center.
Mike, do you want to add anything to that motion? Are you interested?
That's fine.
No? John, is that?
I make that motion.
Okay, so John so moves, and I second that, okay? Let's have a vote about that. All in favor?
Aye.
Aye.
Okay? Aye. Well, the motion passed unanimously. You know, I think roll call votes probably are superfluous when you have unanimous votes.
Yeah, I know.
Because everybody voted yes.
Yes. And I know before, Mr. Chair, I know you're going to the Stockbridge Bowl thing, but since we had Mike here, I wanted, if I can just talk about the meter that we ordered, because I know we're working with Mike.
Yeah, what, we have an agenda item for that. I think we can move it up a little
Okay.
bit and let Mike get to lunch or whatever he's going to do.
Back to work.
Back to his ice coffee. Okay, so you want to, okay, so let me just bring, we had a cyanobacterial, this is to talk about the spectrophotometer tools and training that we are looking at because of a Stockbridge Bowl advisory that we had a while ago. A couple of weeks ago, there was a concern that there was a cyanobacteria bloom on the bowl south of where the island is, just north of the outlet. And when you look at pictures, it certainly looked like it could have been an oscillatoria. That is pictures from the boat, an oscillatoria bloom. So we took the step to protect people, and we issued a temporary advisory. Jim is the one who issued that advisory, and he and I talked about that. And then there were some pictures taken, aerial photos taken. And that was from Parks and Rec, I think. They had the camera or something like that. And it became more clear that it probably wasn't a bloom at that point. But with the cyanobacteria, Jim has to do an advisory if there's a visible scum. And this was a kind of fire drill, if you want to think. Some lakes, they have blooms every summer, a couple of blooms every summer, and they can identify and they do stuff. But we're not, fortunately, we don't see these things very often. And so we wanted to be on the safe side. And we got Dr. Cortman's group involved, Ben Burpee, who's a PhD in that group, consulted us. Mike Canales was there, and let's see, who else was there? Tony was there. Let's see, I think that was it. Pardon me?
Mike Buffoni.
Yeah, Mike Buffoni was there, that's right. And, Mike is very practical in terms of knowing he goes out on the lake and does the testing of the water for the routine tests that we have for the Stockbridge Bowl Stewardship Committee's in-place testing for just the general health of the lake, and also specifically to be informed better about the cyanobacteria blooms. So he's definitely very knowledgeable about that. And we discussed this, and we found out from Dr. Burpee that there was a spectrophotometer available. So what we did is we tested the water, and we sent samples off, and Burpee looked at it. The state doesn't test the water at the present time when a bloom is first suspected. They'll only test it after the scum disappears. And there's a lot of science behind that decision. I won't get into it now, but they won't do that then. They'll test it after that, but they won't do it before the bloom or when you're suspecting it. We have to figure that out ourselves. And so Dr. Burpee took the sample, and he found out that it was just a regular algal bloom, not a cyanobacteria bloom. And we lifted the advisory. I think that was, within 3 days, 2 days, 3 days?
48 hours.
Pretty quick. It wasn't didn't do too much. In the meantime, we had buoys placed out on the lake and to ward off people from that area. And we actually set in place a kind of limited advisory. Rather than with the first bloom we had a couple of years ago, we closed the whole lake down. And again, we're not familiar with the way these things distribute in the water with wind and with currents and everything like that. So we just closed the whole thing down at that point. With this, we basically isolated it. We could see from the aerial photos that it was isolated and put into place the possibility of us in the future doing just that. In other words, if we especially become more experienced with it, if we have a real bloom, isolating it. And that's something I've been investigating a lot more, and I hope that with time we'll be able to talk about that some more. But in the meantime, the other aspect of this that we learned at the time was Dr. Burpee told us that besides, instead of sending samples to him every time we suspect there might be a bloom, we could do a very simple test ourselves. The test, would involve sampling the water. And then we put it into something called a spectrophotometer, which is basically something that has two different frequency light beams that pass through the sample. And the sample then picks up more or transmits more or less of each of the different light beams. And one of the light beams has a frequency that's very specific for the photosensitive pigment that cyanobacteria have. And the second one has it for more general stuff. And so with the differential transmission of this particular sample, you can determine whether or not there's a cyanobacterial bloom or not. This is based ultimately on the fact that cyanobacteria have a photosensitive pigment that has a different frequency of preferred pickup than regular algal, true plants, and stuff like that. I think they call it all of a sudden I have a mental blank on the name, but it's a different frequency. And there are quite a number of different photosensitive pigments, sort of like in your eye. You have rhodopsin that picks up red light, you have rhodopsin that picks up green light, and rhodopsin that picks up blue light, and they're differentially sensitive. So as a result of that suggestion from Dr. Burpee, Jim spoke to Mike Canales, and basically, you want to take it from here, Jim, and tell me about where we are with the
Sure. So we went back and forth on suggestions on ordering one of these things. And and I think we were discussing a way to see if the other towns would be willing to go in thirds with us. I don't want to bore you with the details, but the Tri-Town operating budget is already in place, and we don't have money in the Tri-Town operating budget, which each town contributes to the operational costs of Tri-Town Health for the three towns. And so I was able to find some other funding sources to at least purchase, which we've already submitted the paperwork to purchase the meter. It's going to take a while to be built. It's around $4,700, and we still need to figure out if the other two towns are interested and whatnot, and then we can figure out the billing later on. But the second piece, and I'm glad Mike is here, is I did send to Ben Burpee, and I think I CC'd you and a couple others about asking for like a training proposal, because the thought would be is we would get the meter, we would be adequately trained, and then we would be the ones that would go out there and take the samples.
Saying Tri-Town or you?
Tri-Town employees, we'd be willing to be trained on it and do the sampling to mitigate these issues. And the best approach would be that all three towns would find it beneficial, because we have Goose Pond, we have Laurel Lake, which is in Lee and Lennox, we have the Bowl. So there's a stake to, if each town pitches in a couple grand. But the missing piece that I would like to figure out is Ben Burpee hasn't gotten back to me. I sent him 2 requests to see if GZA would give us a training cost, and then we can just fold in the meter, the training cost, and then divide it by 3, and then ask each town to pay their share.
And I would point out just to overnight ship it so we could get immediate answers, and the rest, we had to send it to the lab and we had to send it to Ben. And it was $380 that we spent overnight shipping it to get a response back as quickly as possible. Like Jim said, I think within 48 hours you had lifted the notice. We're still going to get a charge from the lab, and then we're going to get a charge from GZA on this. So you put together what one of these costs, It'd just be so much better to go right out there, test it, and then know whether we need to
Yeah.
close.
Yeah, we don't even have to start the advisory, and maybe, in fact, for certain kinds of water activities, it will be crucial not to do it. If the bloom happened to be near the town beach, for example, we would have had to have closed the beach. But because we isolated and we were able to do that at that point, we didn't do it, right? So I think the cost benefit ratio is going to, especially if we do get into a situation with the heat and all the other stuff of actually having blooms, we're going to have to look at that idea more frequently. So I'm very happy that this is moving along like that. And I'll see if I can get in touch with Dr. Burpee myself.
Yeah, I mean, we got time, but
Is he on vacation
we
somewhere?
ordered the device. They have to build the device. So like, I don't want.
It's not gonna happen this
I don't want the people to get the expectation we're going out next weekend when we got to get the device. We need to understand how to use it. And so I think the piece that we still need is a proposal from GZA. If someone can maybe help me bump them a little bit, training and, we just don't want to go out on an island figuratively and literally sampling this kind of stuff with no formal training.
Well, so where are we going to go with that proposal?
So right now, we
Questioning the
did,
proposal.
we did order the device. That's probably going to take a while by the time they process it and whatnot. And then it'd be helpful to see if GZA will be willing to give us a proposal for training. We don't have that yet. And then those costs, we'll total those costs. And I'm not sure, Mike, if the other two towns have been engaged yet on their willing.
But I'll
Yeah.
engage both.
We got time.
Chris.
Yeah, we got time.
About it.
Yeah.
All right, so you're going to be point on that then? Or for getting the GCA approval, or are you going to do that?
I'll resend it.
Okay. All right.
You're saying GZA?
Yeah, that's a company that it actually has a lot of hats. But the part that we deal with is related to the Stockbridge Bowl, the original lake management plan.
Right.
The dredging, that was another aspect of GZA that was slightly different.
That's a milfoil issue?
And that's another aspect of the bowl. They're also related to Dr. Cortman, who came in because of the original cyanobacteria bloom.
Right.
And he also was helping the Conservation Commission out and relating to herbicide use in the lake.
But GZA is a company that we engaged to.
Yes,
Second
right.
question on the device you're getting for the spectrophotometer. Does that give us an instant response? Or as you're saying, do we take a picture or we take a sample, we have to send it out?
No, we do it. We do
That's
it.
the
And
question.
he's saying that the Tri-Town, the people in the Tri-Town department will be trained to do that.
Right.
And that way we can have it totally internal.
Rather than sending out samples.
Exactly, what I want to
Yeah.
know, because,
It has
sometimes you
to
take
be
a water
internal.
sample and you still have to send it out.
No.
So this is an all-in-one piece. We could do the whole thing.
I think so.
Take the sample, test it, and have the result.
Yes and no. We can do the whole thing if it turns out to be negative. Okay, in other words, if we test it and there's no bloom, then that's the end of it. Okay, we don't have to do anything.
Right.
But if it's positive, then we have to, put the advisory in place, and then we have to deal with the like I was talking about, the idea, and eventually I'll bring this before the board about a potentials and what the paradigm would be to set up a limited advisory, under what circumstances we could do that. But we would then have to wait and follow the state guidelines. We wait until the visible scum disappears. And when that's happened, then the state will come in, right? Because we take the samples, or do they take the samples?
2 weeks after, so we issue an advice, say it's cyanobacteria bloom. These are state protocols, by the way.
Yeah.
We can't circumvent minimum protocols. So the whole point of the meter is to quickly figure out.
Yeah, no, okay, Jim, I'm getting
to that. So just to quickly wrap this together, it's a quick way for us to do a field test to determine if we have cyanobacteria or not.
If it's negative, we're done.
We're
If it's
done.
Positive, we have another
But
whole
we-
series of.
So basically, if we
Yes.
have a visible scum, the scum itself requires us to issue an advisory if it's cyanobacteria.
Right. And there's another group that actually is on doing a lake patrol to look at, are there areas of suspicion? And that's done by the Stockbridge Bowl Association, where they go out and look at specific areas, say, oh, who does that on a regular basis? There's scum. You did it last time because you were there, but is there anybody, who's the group?
So let me just parse out, there's too much going into the same question. So like, so the advisory, the Board of Health has jurisdiction and requirement to issue a public health advisory. 2 weeks after it dissipates and disappears, the State Department of Public Health will come out and sample certain water columns to determine if it's below the 70,000, whatever it is, that, so then we would lift the advisory. Regarding the other stuff, there's a whole Stockbridge Bowl Stewardship Commission, GZA is a consultant.
The harbor master may have spotted this.
It's just reported back.
It's people self-monitoring.
We don't have any. It's just reported to us, oh, there's an
Yes,
area.
that's what I was curious.
And that tripped the whole thing. That got us to bring aerial photography in. We took a quick pictures and we got.
Right. So we rely on the goodwill of people to say, hey,
Yeah, there's enough people on the lake that if they see something.
Sort of like fire.
Yeah,
You don't have-
there's a Stockbridge Bowl Stewardship.
somebody sees smoke.
There's a Stockbridge Bowl Stewardship Commission. There's a lake management plan. So, and I think there's so many eyes and ears on these water bodies. Tri-Town gets complaints every day, whether they're valid or not. We have to respond to them. And I actually want to thank Mike. We spent a lot of time on the phone that day going back and forth, and he went out there and I went out there. And so to try to figure out that advisory, we all work together, but there's so many people are involved that could see the bowl. And a lot of times we get inquiries.
Do
And then-
you want to standardize the advisories as being limited, partially more advanced, or how do we arrive at these advisories?
That's the question that I'm working on.
Like, I think we're all
And then
set
I'll
unless you
try-
want to
I'll try to-
stay.
no, we'll put it-
Don't feel obligated.
I'll broach this subject. I have to do research and find out if people are doing this and how they do it. And I think there are a lot of aspects to it that have to be figured out, but I'll try to get some information and bring it to one of the future meetings so that we can discuss that as an option. I'm trying to get that in place.
One of my thoughts, John, is like, I wouldn't encourage us to standardize an advisory because it could be specific depending on the situation, right? Like, is it cyanobacteria? Isn't it? Is it a consolidated area of the bowl? Is it the entire bowl? So typically what we do is, since we're experts at advisories now, whether it's, whether it's cyanobacteria or COVID, whatever you want to call it, we gather the facts based on what we need to do to protect the public or advise them. And then we sort of tailor it to whatever we need to. In this case here, my gut was telling me it wasn't a cyanobacteria bloom because I have never seen a bloom that early in the season. But we didn't know that until we collected the samples. We always want to put public health first. Sure. Even if we're wrong and whatever, we always want to protect the public. Even
Like a fire drill.
during the advisory, I saw someone out there paddling over the gunk. So it's a way to like let people know. It's easier to lift an advisory than to ignore it and someone gets sick and then that.
Totally agree.
Part of my question also is to standardize who is being advised and how are they responsible for spreading the advisory? Because, how do you bring the word around? I mean, I heard about it.
Jim posts signs.
So
Okay, so you post signs there.
So there's a combination of people and
Yeah.
Mike and his department heads help as well. When it was the full advisory, we issue a press release. We let the media know. We put on websites. I let the towns know. We let the harbor master know. And any like public points, we put signs up. The advisory recently it wasn't even accessible by the public. It's all private property. So like, we don't like knock on doors and say, you got to post a sign because it's not. So again, it gets down to
That gets a little tricky there.
and Mike, works with his, Mike Buffoni, the harbor master, the Stockbridge Bowl Commission. We just sort of have this incremental way. Plus, I think if there's like a major public health advisory, I think you have the notification.
And we put out the
Yeah.
rest, so.
Yeah.
Yeah, well, we moved as quickly as possible to just identify what it was, and then put up what we needed to put up, and then immediacy, and then once it came back negative, we lifted everything. If we had to, we would have moved to the next step, which would have been the code red. We would have identified the whole lake area. We would have put out notices and through our various systems. So,
To John's point, sometimes the town will send a message through the phone to,
yeah, that's code red.
code. Okay.
Right. Thank you for coming to our meeting, and we're going to let you off the hook. Okay, so let's move on from this last
Thanks, Mike.
topic then.
Thank you.
And want to finish your updates?
Yeah, I don't have, unless there's any other questions, I'll move on. Just real quick, for Tri-Town updates, we're new fiscal years in effect. I gave Elias like a welcome packet with some high level stuff. It's not everything, but our articles of operation, some of the tobacco regs, there's some resources in there as well. We're finalizing the fall flu season schedule for South County. We're putting the finishing touches on that. We'll be offering the flu, the high dose, and the most recent COVID boosters. Let's see. Right now it's sort of quiet. No code violations on any housing or restaurants. We did have to shut down the Eden Hill Sports Camp pool. Well, beach. It's not a beach. They have a pond, and the White Pines section of the pub. Their access of the beach because it exceeded E. coli levels, which is a reflection of the heavy rainfalls we had over the weekend and stuff. We've resampled it, and they're back to being open. And just as a frame of reference, our Tri-Town department, we're the agents of the 3 boards of health. We do all the inspections and code stuff, and we test our own public beaches from Memorial Day to Labor Day weekly for E. coli levels. We do the Town Beach, White Pines, Tanglewood, a few other locations, just the public beach areas. We don't test private properties and stuff like that. So when we have an exceedance, we actually have to close that beach down, post it, and we resample it. We actually do our own sampling at Tri-Town Health for the beaches. We don't subcontract out. It's a system that we've put in place years ago. We test for coliform and E. coli. We talked about the opioids and it's an open invitation. Anytime any board member wants to come out and inspection, come down to the office, we want to meet, go over things. We do a lot. Tri-Town is the oldest health district in the state. We're the oldest regional health district in the state, and our Southern Berkshire Collaborative, which is a combination of Tri-Town leading an effort for South County. We have a comprehensive public health nurse program. We're about to hire a regional inspector for South County through Tri-Town Health, and we're getting a significant amount of grant funding to better improve public health services. Tri-Town has been functioning really well and very highly for a long time, but some of the other towns they're so far behind. We're getting some grant money for that. And that's really I think that's all I have, unless there's specific questions from the board directly to me.
And your staff is still consists of John and
So there's myself,
Yes, sir.
Zach.
right?
We have John, who's full-time. We have Jason, who's full-time. And then we have all this other staffing stuff going on. We have Jane, who is our coordinator for the collaborative, which is the South County group. Jill Sweet is our full-time nurse for Tri-Town and a few of the other towns. And we have our co-responder now, mental health clinician co-responder, just for the 3 towns. That's sort of to help the police department on de-escalation, some things there. And we're hoping to look for a community health worker at some point and another regional shared inspector through the state, because they're funneling almost $500,000 to us. This is outside of the Tri-Town operating budget, by the way. We have our core Tri-Town funding. And then we're getting all this extra money to build some services for South County through Tri-Town, because we kind of know what we're doing. So there's a lot of moving parts. 15 years ago, it was me and one other person. Now we have an army of staff. So, but it's a reflection on the importance of public health coming out of the pandemic.
Yes.
And they're finally putting resources into public health, which have been heavily ignored for a long time.
if I may, on the co-responder, that's a new one or something I certainly support because from a psychological point of view, I think that's critical for law enforcement. Will we be able to get some type of a review of the impact of that individual in working with law enforcement?
Yes, we will.
Interventions they've been making, the effectiveness of it at some point, maybe a year after?
Yeah. So right now, the 3 towns are pitching in to make it's a full-time position. Ivy Goodwin's our clinician. And so she does track the number of calls she responds to, community engagement, certain other things. We're sort of building the road as it goes because it's the first model of a municipal funded co-responder. We've always subcontracted out to the Breen Center, who never really had the capacity to help the towns. So we have a town employee now delivering that. And so, yeah, there's certain pieces of information I'm having her track, but obviously only like metrics, nothing you can't.
So will this person go out on a call, say, with the police department?
Exactly what it is, John.
Okay. And they will not do it with the Pittsfield Police. This is just the
Yeah.
Tri-Town.
Right now, it's not, right now it's the 3 towns.
Yeah.
I think, I mean, ideally, I'm putting my regional hat on. I would love to expand this into some other towns, like in Great Barrington and others. But, like the 3 towns are funding it.
Yeah.
Other towns, I don't think they're fully committed to funding a position of this magnitude. It's, you can't just throw a couple $1,000s from Great Barrington and say, oh, can we have access to your co-responder? When Lee and Lennox and Stockbridge are paying $45,000 a piece.
Yeah.
Well, I like Elias's point to be, to watch what's going on and to actually verify that you've made a good decision doing this stuff. I think it is going to turn out to be a very positive aspect of it. Again, anecdotally, my son's significant other is a policewoman, and this in New York State, and she deals with a lot of family, violence and stuff like that, and she finds that these people, when they come in to help, and are there at the same time, are very helpful in mitigating the whole thing. And a lot of times even eliminating the need to arrest people.
Yes. One of the things I think we'll find out is that after the initial contact where the correspondent will go out with the police, that then familiarity with that when that person calls again, the police don't have to take the time, but the correspondent can go out on their own because they already know the case.
You've already had
So it
those cases.
saves police time
And it made by that familiarity that people feel less threatened too.
Yes.
It turns
We've already
the whole thing from
I think it's a
being a
terrific-
confrontational thing into being a supportive one.
Exactly.
Which is really what your goal is. You
That
want
is
to be
the goal.
supportive rather
It
than.
reduces the burden on police.
Yeah.
It changes the focus of the intervention.
But I
So-
still think that your point to, to have a verification that it's a valuable thing in place. And I would suggest maybe you might come up with a few things that you would consider to be important, considering your background, what you might consider to be important, and pass them on to Jim, so he would make sure that he.
Well, and I'll hook you up with Ivy. You can have a conversation.
I think that's great because I could ask this individual, like, what is she finding out? The number of calls, the interventions made, because then if Great Barrington or largest town, can they extrapolate from our experience what they might be able to use and the effectiveness in saving the time of police?
So maybe you can give us an update, a report at some point about what you've set up with that, or how it's set up. And then at some future date, give us a final report on how it's actually working out. Would that be reasonable?
Well, what I'd like to do is meet with the individual and just get their idea of what are they doing? What are they already looking at? Because in a new program, they're going to be looking at number of contacts and then total interventions, because 5 contacts may have 20 interventions. So the number of people being used, how many interventions are necessary, the success of it, what they're looking for, and how do you measure success? Then once I get that, I'd like to bring it back, say,
I think that'd be valuable, don't you, John?
Oh, absolutely. I mean, speaking of anecdotal stories, I mean, I can name one anecdotal story that happened in Pittsfield about a year ago. A young man who's having a moment of not having had his meds, had a knife, and the police shot him dead because there was no one there to talk this kid down, because the person who normally rides with the police had taken off at 5 o'clock. So it was after hours, and the police did what they usually do and unfortunately shot him in the chest dead. And it's a sad thing.
And we see it a lot with people with mental illness. Police aren't trained, and rightfully so, to deal with, psychotic states, manic states, delirium for whatever reason. And it's scary.
Well, I think that's John's point, I think shows that the extreme of the negative aspects of not having that thing. But I think that what you're also talking about, if I don't misunderstand you, is the efficiencies
Absolutely.
that are built into having this kind of person there in terms of limiting interactions in the future with which aren't, they can be avoided.
Absolutely, because you can use that for getting more grants,
Yeah.
talking about the effectiveness of a program, and then pass on even training other communities. So,
And we're-
we set it up with my meeting, her name is Ivy.
Ivy, good one, yeah. And we're still, and not only is, she's not just doing the police department, de-escalation calls. She's actually gone out with some of our health inspectors to some of the housing cases. We had hoarding, and we had a case in Stockbridge where Ivy met with them and then went back after the police weren't involved anymore and engage that. So we're sort of building the road as we go because it's a brand new program and there's still a lot of work to be done. But it's just one of those things where I love to, get together with you and Ivy and, think about what we can do on there's sort of like the police side of things, right? And then there's like the community side of things.
And you also have the first responder. Somebody has a heart attack, goes in, then sees there's hoarding going on or other issues, then this person go in as a supplement to what they saw to investigate. So I think it's a great aspect. I'm really pleased.
I'd like to, hopefully it's a long-term commitment because I think it's really needed.
Yeah, mental illness being what it is and on the rise, and suicide prevention being always in our minds, I think this is a very, very good program.
Yeah, so I just want to use this as an opportunity to take off one more time on these illustrative aspects of the board just for your benefit. We each of us gets a certain niche of interest and expertise. And I think that if you can grab that and take it, that would be something that we'd really love to see. Everybody does different things. And so that I would welcome you to take whatever interest you have there and develop it as much as you want. And secondly, I just want to remind everybody that Jim certainly is determines from time to time aspects of the budget on the agenda, other aspects of the agenda for Tri-Town Health Department. And if we have certain special code issues in town, or he brings to our attention certain kinds of problems in town, he puts that on the agenda. But I want to encourage both of you to always remember that if you think we should have a meeting, let me know. And if you're having a meeting and you want to have something on the agenda, then please either let Jim or me know, and we can, we'll put it on the agenda, and that's what we do. So that's an encouraging, I really want you to think about that. And the other thing I'm just going to suggest, this is just a suggestion, is, and it helps out when the next meeting comes, is after you've done the minutes and you think you've got a good draft, please give it to Jim. And Jim will disseminate it to John and me, and we'll be able to look at that in due time before the next meeting. That way we can all have read it before it comes. And does that make sense, Jim?
Yeah, so in summary, Stockbridge, we don't have a set meeting schedule for Stockbridge, but we meet as needed, but we try to meet every 2 or 3 months quarterly. And then Tri-Town meets quarterly. So basically how it works, Elias, is.
And you're a member of the Tri-Town.
Each Board of Health is autonomous. Leap Board of Health, Lennox Board of Health, and Stockbridge Board of Health. They meet independently on town-specific issues.
Right.
But then we come together as a Tri-Town board to talk about the budget. We got to do regulations, for example. So we all meet as one unit as a Tri-Town board. So if you see an email talking about a Tri-Town Board of Health meeting, it's Stockbridge with the 2 other towns together.
So it went from 4 meetings to 8 meetings.
No, we don't have it. Believe me. We were meeting a lot during the pandemic, but we tried to.
You attend every one of the town meetings?
Every one of them.
Okay.
My job times 3.
Okay.
Okay, so it's coming up on 12:30. We've gone through all the items on the agenda, and I would like a motion to adjourn.
Motion to adjourn.
Okay?
Second.
All right, all in favor?
All in favor, aye.
Thank you, everyone.
Thank you.